Om Swastiastu. Hello everyone, welcome to Sgd B3, and this is our student project with the title of IDC's Refractive Amblyopia. This is our group members, there are 12 of us, and you can see our name in the screen. This is the table of contents, there are 3 chapters and will be explained in our student project. Chapter 1, Introduction. 1.1 Background. So a lot of people may have heard or known lazy eyes from some certain person, maybe such as friends or family. And refractive amblyopia, also known as a lazy eye, occurs when there is a significant focusing error in one eye. And refractive amblyopia is also known as refractive or anisometropic amblyopia and occurs when there is a significant differences in the refractive error between the two eyes. 1.2 Problem formulations. In total, there are 8 of problem formulations that will be answered and explained in our student project. Next one is objective of study, and this is benefits of study. There are 2 main points of these benefits of study, and you can see in our screen. Maybe that's all from me, and the next one will be explained by my friend. Thank you.
Hello, my name is Komang Ayu Widhiani, and my last 3-digit of student number is 044. And now let me move on to the next chapter, Chapter 2, Content. 2.1, Definition, Etiology, and Risk Factor of Refractive Amblyopia. Amblyopia is a disorder of the development of sight. It results from early ocular disease that prevents corticovisual growth in either or both of the eyes. Even if the ocular pathology is addressed later in life, untreated amblyopia causes permanently impaired vision in the problematic eye. It is the most typical reason for reduced vision in one eye in kids and younger people. Early in childhood, amblyopia develops while the visual system is still growing and is unable to send a clear image to the visual brain. Medioopicities, strabismus, cataracts, or anisometropic refractive abnormalities that put one eye at a developmental disadvantage to the other can all lead to the amblyopia. A severe refractive error or bilateral cataracts can cause amblyopia, which often develops unilaterally. How we see as adults is influenced by how we perceive as infants and youngsters. That's all from me, and my friend will continue the presentation. Thank you.
Next, I'm going to continue definition, etiology, and risk factor of refractive amblyopia. But first, I'm going to introduce myself. My name is Joshua. My last digit number 205. So, amblyopia can be broken down into 3 main causes: deprivation, strabismus, and refractive. Deprivation is caused by any disease or condition that blocks the visual pathway. Strabismus occur when both eyes are not in line, and refractive is usually caused by myopia, astigmatism, or hyperopia. In children, the chance of having an amblyopia is higher if they have this condition. They were born prematurely, their body were smaller than the average at birth, have a family history of amblyopia, childhood cataracts, or other eyes condition, and lastly, have developmental abilities. That is all from me. Thank you.
My name is Nyoman Dimas Pratista, three last digit of my student number 201. Now I would like to present about classification of refractive amblyopia. Refractive amblyopia can occur as either isometropic or anisometropic amblyopia, depending on the nature of the uncorrected refractive error. The first, isometropic amblyopia is uncommon, high uncorrected bilateral refractive error, blur image, cause hyperopia greater than 5 dioptries, myopia greater than 8 dioptry, and astigmatism greater than 2.5 dioptry. Second is anisometropic amblyopia is uncorrected refractive error, significant difference between eyes, blur image, disturbed visual development, severity correlated with anisometropia. Thank you.
My name is Ngurah Aryawangsa with my last digit number is 144. Now I will explain about pathophysiology of refractive amblyopia. There are 3 key stages in the development of human visual acuity. During these times, the numerous processes that induce or cure amblyopia may have an impact on vision. The following are these times. From birth to the age of 3 to 5 years, the growth of visual acuity from the 20 to 100 vision range to 20/20 vision. The time within a few months to 7 or 8 years is when deprivation amblyopia is most likely to occur, and the time span between the start of deprivation and adolescence or even maturity, during which amblyopia can still be healed. Although there are multiple types of amblyopia, it is thought that they all have the same underlying mechanisms, even if its component may have affect amblyopia in a different way. That's all from me. Thank you.
Hello, my name is Kadek from the Agastya Karna, and my last three-digit number is 165. And now I will continue the presentation with clinical manifestation of refractive amblyopia. There are three clinical manifestations of refractive amblyopia. The first one is decreased visual acuity, which is the primary indication of refractive amblyopia. The diminished visual acuity occurs because the brain suppresses visual input from the amblyopic eye, leading to underdeveloped visual pathways. The second one is anisometropia, that refers to a substantial difference in refractive error between the two eyes. The brain prefers visual input from the eye with better visual acuity while suppressing input from the amblyopic eye, hindering its visual development. And the last one is strabismus, which is characterized by misalignment of the eyes, is frequently associated with refractive amblyopia. The brain suppresses visual input from the amblyopic eye, leading to a lack of coordination between the eyes and further impairing binocular vision. That's all for me. Thank you, and my friend will continue the presentation.
Greetings. Hi, my name is Rituga Putri, with Rosikus of students number 235. Now we're moving on into diagnosis of refractive. To establish the diagnosis, there are two main points we needed to highlight on. The first one is histophysical examination, and the second one is screening tool. First, in histophysical examination, we can ask the patient with the history before the sign appearing, or we can ask if there's a behavior signs like torticollis, especially with toddler and parents. Also, history of families such strabismus with higher risk in amblyopia. For physical examination, we can do corneal refractive light and finding process. Screening tool that also support the diagnosis is based on visual acuity that existed in Snellen chart and Bailey-Lowy-Veris, which will give a result of 6 by 9 or 2 Snellen lines. That's it for diagnosis of refractive amblyopia refractive. For next topics will be brought by my friends. Thank you.
Hello, my name is Kevin Andrian Candra with my Sgd number 095. Today I will explain the differential diagnosis of refractive amblyopia. Amblyopia is a diagnosis of exclusion, in that it can be only diagnosed when all other ocular or cerebral pathology has been ruled out as a cause of reduced visual acuity. The differential diagnosis of amblyopia includes: first, a pattern esotropia and exotropia. A pattern strabismus refers to a vertically concomitant horizontal deviation of the eye. Second, accommodative esotropia. Accommodative esotropia is a type of strabismus characterized by inward deviation of one eye due to incorrect hyperopia and abnormal accommodation. Third, aqueous esotropia. Esotropia is a type of eye misalignment where one eye turns inward toward the nose. It typically develops in children at 2 until 5 years and is rarely associated with an underlying disease. Fourth, aqueous exotropia. Exodeviation or aqueous exotropia is a form of strabismus where the eyes differ outward. The condition usually starts as exophoria and may progress to intermittent exotropia before becoming constant exotropia. That's all from me. Thank you.
My name is Raymond Budianto with Sgd number 161. Now I'll explain about the management of refractive amblyopia. Risk of blindness is higher in people with refractive amblyopia than in general population. Management should be directed toward the two primary etiologies of amblyopia, which are from deprivation and binocular inhibition. There are available treatment options for amblyopia. The first one is optical correction. The rationale for correcting the refractive anomaly with spectacles or contact lens is to ensure that the retina of each eye receive a clear optical image. For correction of the ametropia is effective in some patients, especially isoametropic and anisometropic patients who are binocular. The second one is occlusion. The rationale for using occlusion is that occluding the better eye stimulates the amblyopic eye, decreasing inhibition by the better eye. Occlusion enables the amblyopic eye to enhance neural input to the visual cortex. It is also important in eliminating eccentric fixation. Occlusion can be classified in several ways, which is by the type, time, and occluder. That's all from me. Thank you.
My name is Aisyah Taqiyyaa with 3 last digit number is 076. I'm going to continue about the management. Active vision therapy. Optometric vision therapy or OTROPIC is employed to address and enhance particular dysfunction within the visual system. Active vision therapy for amblyopia aims to correct deficiencies in 4 specific areas: eye movement and focusing, spatial perception, efficient focusing ability, and binocular function. Management of deprivation amblyopia. If a significant physical obstruction, such as a congenital cataract, is detected early, the initial approach should involve consulting an ophthalmologist to consider removing an obstructions within the first 2 months after birth. Management of isoametropic amblyopia. The primary treatment of isoametropic amblyopia involves completely correcting the refractive error using glasses or contact lens. Management of anisometric amblyopia. The first stage of treating anisometric amblyopia involves completely correcting the refractive error using glasses or contact lens. Merely addressing the refractive error can lead to improvement in visual acuity for certain individuals. That's all for me. Thank you.
Okay, my name is Gusti Dinda Pratyaksa with the last 30 teachers from 12. So I'm going to explain about the prognosis of refractive amblyopia, which depends on some factors such as the age, type of fixation, amblyopia depth, and the previous treatment. The first one is about the age. The earlier the person has been treated in the age will have a better prognosis. And the second one is about the type of fixation, there are two types. The first one is the wandering foveal fixation, and the second is the steady eccentric fixation. And those who got the foveal fixation will have a better prognosis, but doesn't rule out the success rate of the eccentric fixation. The third one is about the amblyopia depth. So the better the visual acuity person has, will be better the prognosis. And the fourth one is about the previous treatment history for the amblyopia. According to the goals and the procedures, surely will improve the prognosis. So the next one is about the complications of refractive amblyopia, which the main complications are the irreversible and lifelong loss of the vision. And people also can experience the decreased monocular vision if someone, especially the infant and the children, had been treated incorrectly, it can cause the amblyopia in the healthy eye. So the second one is about the development of the strabismus due to this not suitable procedures. Also, there is no strabismus before the treatment, and the patients with amblyopia will have worsening perceptions, and for the children will have difficulties in reading, which can lead to the decrease of the cognitive level. So that's all from me about the prognosis and complications of the refractive amblyopia. Thank you.
Okay, hello, my name is Putu Dinda Pramesti Sudastra, with my student number is 130. Now I want to explain about chapter 3 conclusion. For the 3.1 summary, refractive amblyopia is also known as lazy eyes that occurs when there is a significant difference in the refractive error between the two eyes. Refractive amblyopia can be classified to isoametropic or anisoametropic amblyopia. Clinical manifestations include decreased visual acuity, anisometropia, and the presence of strabismus. Differential diagnosis for refractive amblyopia include a pattern esotropia and exotropia, accommodative esotropia, acquired esotropia, and acquired exotropia. Available treatment for refractive amblyopia such as optical correction, occlusion, active vision therapy, and specific management for deprivation amblyopia, isometropic amblyopia, anisometropic amblyopia, and strabismic amblyopia. The prognosis for cases of amblyopia will depend on several factors such as age at the start of treatment, type of fixation, binocular vision, depth, and previous amblyopia treatment. And for the last one, the main complications of refractive amblyopia are irreversible and lifelong loss of vision. And for 3.1, the recommendation, the writer suggests further research about how to prevent and treat refractive amblyopia so it doesn't become a lifelong condition. Writer realized that this paper is still far from perfect and therefore suggestions and constructive criticism will be useful for the improvement of this writing. We also hope that this paper contains useful information and gives advantage for the readers. Okay, so that's all for us about refractive amblyopia. Thank you, and Om Santi 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 Om.